Hi everyone, I'm Dr. Freeling and I'm back here. I wanted to talk to you guys about masseters today. I get a lot of questions in my office about masseters and if there's anything you can do. Actually, nobody specifically comes in saying that my masseters hurt. But the minute somebody walks into my office, I can often tell, number one, if they're chewing gum, which is pretty obvious, and number two, if their face is asymmetric and they have a little bit of hypertrophy or thicker lower face on the lateral sides where the masseter is. And this is an indication of either clenching at night or grinding sometimes, but more often clenching, and it's often asymmetric. So one side can often be stronger than the other side. And when I evaluate patients, and if you guys have questions about this, write below and I can address them more clearly. But in general, when patients clench, they are causing so much tension in their lower jaw, in their neck, in their back, in their head. This can cause headaches, this can cause migraines. We can even do some treatments down in the trapezius and the shoulders and those muscles to alleviate any referred pain from that tension just from clenching. So a couple of things I wanted to show you. You can see my nice little, I need to name my head here. I don't know what their name is, but we should find one. But a couple of things that we should really be aware of when getting masseter injections, okay? We'll talk a little bit about anatomy, and then we'll go into a little bit more of frequency and dosing and that kind of stuff. So the masseter, as you can see here, if my muscles fly off of my face, I'm so sorry about that. The masseter here is actually quite large, and it is posterior on the lateral aspect of the face, and if you just put your fingers here, you can feel it when you clench down, and one side is probably stronger than the other side. So the anterior border of the masseter is a place that you actually want to be very aware of for multiple reasons, as that is where you have the facial vein and the artery meet, facial artery coming up to supply blood to the head and the facial vein draining blood here, and they meet right at the anterior border of the masseter. You want to stay away from that area, okay? That is also where the post-jowl sulcus is. So you can feel that in the mandible, in the jawline when you press down. So the anterior border of the masseter also has some muscle fibers that commingle from the risorius muscle. The risorius muscle is a muscle which is kind of cut in half on this one, so I'm sorry about that, but it comes to that lateral commissure of the mouth and it extends laterally across the face and it pulls your smile out, right? So it allows you to smile, as well as other muscles that allow you to smile and make animations of with your face. But the risorius allows that lateral pull of the lateral commissures of your mouth. So there are fibers that commingle and intermingle with the anterior border of the masseter. So let's say you do your masseter Botox injections or neurotoxin injections too anteriorly. You're going to grab those fibers and your patient's going to come back in a couple of weeks and say, you know, I couldn't smile as wide as I thought I could. So that's something to keep in mind, okay? It's okay, you should be aware of anatomy, but sometimes, depending on patient factors, everybody's a little bit different with their anatomy. And let's say they went for a walk or a run and maybe put their head down, who knows, that neurotoxin migrated, got a little bit with those fibers of the risorius and they affected the smile. It will wear off, but it's something to be aware of and always something to educate your patients about as well. So the other thing about the masseter is there's three bellies of the masseter. There's deep bellies and superficial bellies. So you want to make sure when you inject the masseter that you get the deep bellies as well as that superficial one to completely relax the muscle so you don't get hypertrophy of, let's say, the superficial muscle and relaxation of the deep muscle, the deep bellies of the masseter. In general, if I use Botox, I like to use a maximum of 20 units per side for symptomatic clenching and headaches. This can be done and will last about 4 to 5 months in my practice. That's what I've seen. If you are looking for slimming of the jawline, it's a different frequency and dosing. So patients that feel genetically they just have a wider, more square face and a wider square jawline, you can do that 20 units or even a little more frequently every month to get more rapid thinning of the masseter and decreased girth and thinning of the lower face. There's something that you always want to be very wary of and careful of when you do this and take this approach. When you make these muscles thin, that does cause some premature aging and sagging of the lower face, because those muscles on either side, the masseter is actually structural support for the lower lateral face. And by thinning that muscle, the superficial tissues don't have as much support to stay tacked back, and you start to notice jowling a little bit sooner. So I often I hesitate to do too many masseter injections. If you come to my office and you know me, you know I'm very conservative when it comes to any injection, but specifically with masseters, because it can affect your smile, it can affect your facial symmetry, but it also can really change your life when it comes to headaches and migraines. Some of my most thankful patients are the ones that do clench and weren't aware that you could use neuromodulators for this indication, and the headaches going away is life-changing. So those are a couple pointers with masseter injections. You can use any neurotoxin that's available on the market today: Botox, Xeomin, Jeuveau, Dysport. I love Dysport and Botox in my practice. And let me know if you have any questions. I hope this helps. Let me know what else you want to hear about, and subscribe, like, and I'll see you next time.